The stimulus law enacted in February requires doctors and hospitals to create electronic health records for every American and make them available to the government and healthcare providers through a national health information technology system. Democratic Representative Patrick Kennedy tells CNSNews.com that patients will be able to opt out of reporting an STD or an abortion on these electronic health records. Would you be able to opt out of having something like an STD or an abortion that was performed out of the records, or will it be required to be on there?
This is totally going to be up to the individual. So, obviously, for the full effectiveness of the person, it's to their benefit to have everything on a record, but it's going to be totally up to the individual. We're not going to get people to fully buy into this if they don't feel comfortable with the record. And the one way to not make them feel comfortable with the record is to force everything on them and say, this is a mandate, you're going to have to do this or that. Because if that happens, then people aren't going to want to buy in and the system's not going to work. So what's going to happen is this is going to be people's opportunity to choose once because they're going to know their safeguards. And I think over time they're going to get more and more comfortable with that this is in the best interest of them and their personal health. But absolutely, we're going to make sure that it's all up to the individual, because we're not going to get widespread adoption if people don't feel that their privacy is protected. Privacy is a cornerstone to making sure this thing works.
Republican Congressman Michael Burgess says providers need all the information about a patient's medical history. Congressman Kennedy said that it should be up to the individual what they want on the records. Do you think that will be what's put into place, or will they be required to put anything that a doctor wants them to put on?
I think it should be up to the patient to whom the information is released. The patient, of course, is the one who's ultimately been in control of divulging that information to their doctor. If they release that information to be shared with whoever requests the sharing of information, I think the patient's going to be aware of that. Again, my perspective is different, and it's more from the standpoint of a provider. I think providers do need to have that information. If I refer a patient to a specialist, yeah, that information needs to go along. It is not only unfair, it is probably a liability on my part if I do not disclose that information to the physician to whom I'm referring a patient. So that's, again, the patient have the ability of to whom the information is released, but ultimately in a medical record, it's the doctor who makes the decision as to what's included in that record or not.
So if, for example, somebody goes in to get a physical and it's revealed that they have an STD and the doctor knows it from an examination, or the symptoms show that it is an STD, would that be, you think, on the medical record, or would the patient say, don't put that on my record?
Well, I think that situation could come up, and then the doctor and the patient need to best decide how to handle that information. On the other hand, if I'm the doctor to whom someone is being referred, and a very important piece of information is withheld, that compromises my ability to give a correct diagnosis. We heard a little bit of discussion about medical errors, but that might increase the propensity for medical errors. So you kind of walk in two different worlds here, but from a provider's perspective, you need to have the information available. Again, the patient should control who gets that information. The patient has, in my office, the patient always had to sign a release to, if I wanted to send medical records along to a specialist, the patient had to sign a release for that. If there was something that the patient perhaps did not wish to have disclosed, that was certainly their prerogative to bring that up with me at the time the medical records were copied and delivered. In an electronic environment, I don't know quite how you sequester that data. Is it all just going to go in one lump megabyte, or will there be different parts of information that can be transferred? And can you sequester parts of information? We'll have to see how the programs are written, won't we?
Kerry Bennett, Representative Kennedy's press secretary, was not available to answer CNSNews.com's follow-up questions before the story was filed. Nicholas Balassi, CNSNews.com, Washington.